Hi, and welcome to the Public Health Spotlight podcast with me, Callum. I'm the co-host here. Um, we have a great guest joining today, Jason Strelitz, the Corporate Director of Adults, Health and Communities for the London Borough of Newham. Jason, welcome to the podcast. Thank you for joining.
Thank you. Great to be here.
No, we really appreciate it. So let's dive straight in. Um, Talking around your career, so your career spans over 20 years in public health, from child health and inequalities to leading Newham's response to the COVID-19 pandemic. What initially sparked your passion for public health?
So, in the first stage of my career, I was very much focused on social policy, and I'd had a long and deep interest in tackling child poverty, in inequalities, and through the 2000s was very much involved with. I worked, for example, for Save the Children. I was involved with working with the government of the time on the ambition to eradicate child poverty. But towards the end of the 2000s, I had a really strong sense that I wanted to get closer to community, to work closer to the ground. And I had the enormous privilege in 2008 to go work with Sir Michael Marmot on the Marmot Review. And I went into it as a social policy advisor, really, with that background. But doing that work really sparked my passion and my interest in public health as a discipline that was strategic, evidence-based, but close to community and passionate about change. And I've not looked back.
Lovely. Mentioning Michael Marmot, obviously in 2009, you did the 2009 review. Having that exposure and that experience so early in your career, how did that influence you, I suppose, as a person, and obviously, your role in public health?
So I guess a few reflections. I mean, I was already very much rooted with that background of social policy and the social determinants of health. So that felt like my space. But what was so interesting about the review was a couple of things. One is I met these people called directors of public health. Like I said, these people who are really passionate, really committed to their areas, really driven by the commitment to social justice, tackling inequalities, to prevention, but really rooted in place. And I thought that is a job that I think I would love to do. And then so meeting these fantastic directors of public health was deeply inspiring. And then obviously working with Sir Michael Marmot was as well inspiring. And there's one thing I remember particularly, and we were having a long conversation about the final report. It was quite early, but we were already thinking about what would the final report look like. And I remember him saying that he believed in the value of a big, heavy report that landed with a thud on the minister's desk, and the impact of landing with a thud on the minister's desk. And that's really stayed with me because I think what he thinks about a lot, and what I've tried to think about a lot, is impact. It's not just what you say, it's the way you say it and the way you deliver the message that's all about trying to have the impact with what we're doing. So that's something that really stayed with me.
Cool. Anything else working with Marmot quite closely? Or is that the main thing, would you say?
I think it's just as kind of connected to that, just his ability to inspire others. That
Yes.
team around the goal, and his incredible ability to bring others on board around a shared goal, which again I've tried to learn from and really embody in my own way through the work as director of public health that I've done.
Like very much purpose-led.
Yeah, yeah, yeah. Absolutely.
Mentioning Michael Marmot, I think he's given you quite a nice rep on your upcoming book that's coming out. Obviously, so the book is around COVID-19. Obviously, being the director of public health in Newham in 2019, it was one of the hardest hitting. Mentioning Michael Marmot, he's given you an excellent recommendation on your upcoming book in relation to COVID-19. Obviously, as the director of public health in Newham, you manage one of the hardest hittest areas of COVID-19. Your book, Same Storm, Different Boats, COVID, Community, and How We've Come Together, it's being released very soon. But not to give too much away, but please, could you just talk us through this stage of your career?
So I think for everyone involved in public health who was working in those years, it was, It was the biggest challenge we could ever imagine, but at the same time, an incredibly invigorating professional challenge. So I think I say in the book that I worked harder than I'd ever worked before. I cried more, but I also laughed more and was inspired more. And I think for everyone in our team, it was this incredible journey where public health went from being a small time part of local government life to really being the central focal point, where the whole entity of local government was turned around to focus on a public health challenge. And we went from being, part analyst, part small time agitator within the system to being absolutely central. And for me, it was absolutely a consuming, defining moment where, as Director of Public Health, I really thought and had to work deeply to think about how to support people in my borough in Newham to navigate the pandemic as safely as possible, and really drawing on all of the skills, the relationships, the evidence, the ideas that I developed over many years, and bringing it all concertinaed into this one incredibly heightened moment.
You said obviously there were a lot of tears and there was a few laughs in there as well. During that time, what were those were there defining moments that you can like really sort of highlight and reflect back on and still probably feel quite deeply now? Like what were those moments?
Absolutely. There were lots actually, but I'll touch briefly on three. The first was the first time the Office for National Statistics in May 2020 released a report showing early on after the first wave, the local authorities with the highest standardized mortality rates, and Newham was at the top of that list. And as Director of Public Health, that was a deeply shocking thing. Like, on the one hand, you understand that there are reasons why the place you work is top of that list. London was hit first and hardest, and it reflected that. Newham's deprivation, its housing context, its underlying health inequalities, all of those factors play into that. At the same time, you believe your role is impactful and meaningful, and you're trying to make a difference, and these things aren't inevitable. Otherwise, what's the point of your role in the first place? So it was deeply upsetting and challenging to see that. And that weekend, I spoke on the phone, unusually, both to our mayor in Newham and to the chief exec, and we were all feeling the same. And we all said, we don't know how this pandemic is going to play out going forward, but let's ensure that we leave nothing on the table, that we've done everything within our means, within our powers. We're as creative as possible, as thoughtful as possible to try and support our community to navigate the rest of the pandemic. And from then on, we did so many things. We had done before that as well, but so many things that I'm proud of and deeply proud of. The second was, I spent a lot of time listening to community during the pandemic. We piloted initially first and launched the COVID-19 Health Champions, went national, but actually it was a conversation with young people that really stuck with me. And it was a conversation about going back to school. And a reality of Newham that's different to most parts of the country is that many young people live in multi-generational households. They live with parents, but they also live with grandparents. It's a feature of life in Newham. And what some of those young people said to me was that they were deeply nervous about going back to school. Not that they didn't want to, they were desperate to go back to school. But what if they caught COVID and brought it back to their grandparents, sheltering a home with underlying health vulnerabilities, and the risk that they carried taking COVID back from school and infecting their grandparents and causing them risk. And it struck me incredibly hard because it wasn't something that my own children were experiencing. For them, going back to school was just something to look forward to without carrying an additional burden of risk. And it's one of the many reasons why the book's called Same Storm, Different Boats. We were all experiencing the same challenge of COVID, but our life circumstances meant that it played out in different ways for different people. And that moment really, really stuck with me. And the final one is, again, listening to community. And about some months into the pandemic, we held a celebration of vaccine stories. And we came together with our community to hear about people's different experiences of receiving the vaccine or supporting others to get vaccinated. And again, it struck me in my community where I lived, people were just chased. The WhatsApps would go around and say when a vaccine was become available, because even before your age, you were the right age, because everyone was desperate to get vaccinated and so aware of how and what they needed to do, and would talk eagerly about, did they have Pfizer or AstraZeneca or Moderna? But in Newham, and that was the same for some people in Newham, but for many others, it was a harder thing. It was a step where they required the support of a daughter or son or a GP who really phoned them several times to support them to get the vaccine, or an imam or another faith leader, because what different barriers of trust, barriers of English language and not understanding the system, or all kinds of different barriers. But through all of those, people showed community, persistence, resilience to get themselves vaccinated, and it made a huge difference in our community. And we said, after that event, and we used the language, takes a village, to borrow a phrase, it takes a village to vaccinate a community like Newham, and it's something that I won't forget.
Definitely. Yeah, very touching and very sort of like just real. I think that sometimes you don't necessarily expect that type of reaction from a community. As the DVH, what was it like internally? Managing the team, keeping morale high. Obviously, everyone's emotions are heightened, scared, frightened. Like you say, there's a massive change of purpose and accountability. All of a sudden, that's probably the light has never been shone so brightly on public health, and for all that to sort of come around at once, whilst everyone is still living what they're looking to try and beat. What was that like as like the leader?
It's funny the way you phrase it, and I totally understand that. But in some ways, I often reflected that leading a team was never easier than in COVID, because people were incredibly motivated, incredibly inspired by the nature of their challenge. And actually, my primary job, I felt, in terms of team leadership during that time was to look after people, to make sure actually they were looking after themselves, to thank people a lot for their incredible efforts, working every hour, to make sure people were taking holiday, even if you couldn't do much with your holiday at certain times. But really just to make sure people were looking after themselves and felt appreciated for their efforts, because actually the kind of motivation took care of itself. People were at like you say, a heightened state of emotion, but a heightened state of motivation as well. It was a really incredible time. And I think many people in our team would reflect that it was absolutely, despite the hours they put in and the challenge, that it was a career highlight.
I would 100% agree with you with all the public health professionals that I've spoken to. And with the public health or the new public health experience that I've had, that's something that definitely took me back. But as I've spoken to more and more public health professionals, the passion and motivation for the job is what makes public health stand out amongst others that I've ever seen. So no, not a surprise with that response. We may have touched on it, so apologies, and we don't have to go over it if not. But was there what were like the most challenging decisions that you had to make through the pandemic? And how did you navigate it to prioritize community health?
I think all the way through, I was really acutely aware that often there was no easy decision, that the choices you were making were between two deeply imperfect options. So one that comes to mind was about returning to school. And it touches both on the story I gave earlier about children who live with their grandparents, but other risks. On the one hand, you're trying to manage an infection. You're trying to take steps that limit people's exposure to becoming infected, unwell themselves, but also becoming another person to pass it on to other people. At the same time, you're thinking about all of the things that are in normal life, that by taking steps to manage that infection, you're stopping so many other things that really, really matter. You're stopping children's education, children's socialization. You're stopping people going to work and earning a living. These things also matter to health. They're not healthy. They're not health. They are health. So you're trying, often through the pandemic, you were trying to balance your view on different things that all mattered for health. So I think the return to school was a really good example. And I remember conversations internally about, were we going to support children coming back to school, coming out of the first wave? And I remember saying, and I write about it in the book, and I've got the memo that I wrote, which said, absolutely, yes, we don't know how long this thing's going to go on for. The current situation may be as good now as it is at any point over the next year. At that point, we didn't know that vaccination would be with us by the end of that year. And I said, school really matters. It matters to children's learning, but it matters to their well-being as well. And yes, there are risks we need to manage. We need to think about how we manage risks for teachers with underlying health conditions. We need to think about how we manage risks for people living with people with underlying health conditions. But we need to find a way to get children back into school. But I was aware equally that advice came with its own drawbacks. So like I say, often in the pandemic, you were choosing between two deeply imperfect options.
Thank you. When is the book out, and where can people get it?
The book is out on October the 22nd. It will be available online. Hopefully, who knows, available in bookshops, but definitely available online from all the normal places, plus the publisher, which is called Hawksmoor Publishing.
Good. Lovely. Thank you for that. We'll focus on a different aspect of your career. Otherwise, you won't get any book sales because you would have given everything away. But with your work at Darlington Social Research Unit, Islington and Camden, focused on early years and reducing inequalities, what's one innovative public health strategy from those roles that you're particularly proud of, and how could it inspire others in the field?
Some years ago, back in, I think, about probably near enough to 10 years ago now, when I was working in Islington, there was a tragic spate of young people dying in knife-related attacks. And I was asked to do a review looking at young people who'd been connected to these. And I looked back at the lives of those young people, and what I saw throughout their lives were a whole range of what we call adverse childhood experiences, very, very challenging family environments that they'd grown up in, but differing. But the one constant across all of those young people had been fragmented journeys through education, in which gradually, slowly, but gradually for all of them, they dropped out of the mainstream education system. And with colleagues, we began to ask ourselves, what could our system, there's lots of different things we could have done for different aspects of those young people's vulnerabilities. But what different things could we have done to keep those young people in mainstream education? And we talked a lot to schools and with mental health services and others. And we developed something called TIPS, Trauma-Informed Practice in Schools. And we began to work with schools, with children's services, with mental health services, and with schools together. Say, how do we need to adapt the school environment to be supportive of young people who are coming through the doors of school each morning, carrying all of those challenges of difficult home lives? That they're going to react differently to school, how my children will, because they're coming in to the school carrying things psychologically that my children don't carry when they go to school each day. And they're not going to necessarily respond to teachers and other staff in the school in the same way as my children will do, because their experience of people and their experience of social interaction has been fundamentally shifted. And if we want to try and keep those young people in school, how do we need to support staff to be able to work with those young people in a different way? And so we developed trauma-informed practice in schools, and which was really about creating environments, which is what public health is all about, creating environments that support people to be healthy and well. And that program had really positive outcomes. It grew from strength to strength. And long after I left Islington, it continued to grow and create that environment in which everyone began to recognize that we as a system, it's not just that you have to just want and expect something different from people, but you as a system need to adapt and respond differently to create an environment that's conducive to the health and well-being of young people.
And what would you say was the main points at which made it successful? Was it the collaboration between the different units that needed to collaborate together, or yeah, what were the main?
Say two things. One is absolutely that collaboration. I often say there is nothing we do in public health of value on our own. Everything we do in public health is a value, is a meaningful collaboration between different parts of the system, because we're engaging in complexity, and no one part of our system is able to change a complex system on its own. And the other thing that really made a difference is and it's another key principle of public health, is that we were evidence-led. Both we embarked on a journey informed by the existing evidence base, but we collected data as we went and we adapted as we went as well, so that we were constantly learning about how to do this difficult and this new thing, learning how to do it better. So I think those two things were really critical ingredients.
Thank you for sharing. Touching on your role now, a bit of a unique role as the DPH and DAS for Newham. I've got a couple of questions on this. So firstly, how was your public health background, or how has your public health background benefited your wider remit to adult social care and working together, again in collaboration?
So it's been super interesting, and I'm not going to lie, I was pretty nervous taking on the role of Director of Adult Social Services, wondering, as a kind of professional lead for a big, complicated operational service who really didn't know very much about adult social care, how I would manage it all. But I think the public health lens has been incredibly valuable. I think the first thing to say is, as a public health person, you're often not the expert in the room. You're often, you deal in incredibly wide range of issues. In a given day, I might be in a meeting on diabetes, on mental health, housing, transport policy, who knows what. On none of those issues am I the expert in the room. I'm bringing a perspective, and that perspective is about, do we understand the issue? Do we understand the challenge that we are grappling with? What does the evidence say? Are we bringing the right partners together around this? What would a prevention lens to this problem look like? All of those kinds of questions, those core public health questions, are deeply relevant to being Director of Adult Social Services. So what I was able to bring was a professional curiosity through a public health lens that sought to understand what it is that we do, sought to really maximize the role of prevention and promoting people's independence and health and well-being through the way we delivered adult social care, that maximize collaboration with partners in the NHS, but also with voluntary and community sector organizations, and really brought about that spirit through everything we did in adult social care. And I think my team really responded well. I never had to pretend that I was something that I wasn't. Everyone knew who I was. I wasn't an expert in adult social care, and I have lent enormously heavily on my senior team of incredible experts and incredible social care leaders. But what I have brought is that public health perspective, which I know my team have found incredibly inspiring, invigorating, and really taken us on a journey that we're quite proud of.
And them getting the exposure of your experience and vice versa, again, just broadens your experience and understanding, right? What are the main benefits and challenges of overseeing both areas?
So I think it's a very broad role. So you can only be in so many places at once. So that's a huge challenge. And the only way you can do that is by supporting a really fantastic senior team across both public health and social care who are brilliant at what they do, feel empowered to be leaders themselves and just get on with it. And that you have a really good understanding. And my role is to set the vision, build the team, and manage some of the politics, and then really support a leadership team to just go out and be leaders themselves.
In regards to obviously overseeing both roles and having such a great senior management team and team in adult and public health, with that collaboration probably being brought together a little bit more because that is your remit. Um, has there anything that you've seen that's really been impacted in a real positive way that maybe hasn't happened earlier in your career where public health and adult social care are a little bit more separate?
Absolutely. And I think it works both ways. So from a public health point of view, I think that proximity to adult social care has focused the mind. Sometimes public health can be a bit detached from some of the core challenges that local authorities are facing. But in Newham, where we've got, like many authorities, an enormous financial challenge, there's a real burning platform to ask the question, how do we support the people who are going to otherwise draw on adult social care support? How do we support them to remain healthier and more independent for longer? And it's focused, I think, really usefully, the public health mind into thinking a little bit more downstream and thinking, actually, who are those people that we really need to focus some energy and effort on to support their health and well-being? And I think that's been really positive and led some really, really great collaborations. I think from an adult social care perspective, it's helped people to really focus their minds on prevention as well. And in a sense, that focusing more upstream than they normally would do. And what are the things we need to do, again, to support people to be healthier and well for longer? So our Aging Well strategy, which is a collaboration between adult social care and public health, really brings that together and focuses on things like volunteering and social connection and neighbourhood safety and quality of housing, really bringing that social determinants lens to adult social care, which I think is of great benefit to both public health and adult social care, and is a real product of that deep collaboration.
Perfect. Thank you for sharing. I really appreciate it. Newham in general in public health now, what are the current biggest priorities that you have in Newham in public health, and what exciting and impactful initiatives have you implemented? It is what it is. I apologize.
No apology necessary, but the nature of Newham's population, which is one where there's significant deprivation, enormous diversity, huge challenges in housing, a lot of high levels of child and older person poverty, mean that from a health perspective, there are, given their health is shaped by those social determinants, we have many health challenges right across the board. At the same time, as a local authority, we've got a burning platform of a real deep financial challenge where the crises in people's lives, children being taken into care, older people and adults requiring care and support, and people becoming homeless, those are crises in people's lives that are also creating an existential crisis for the local authority. So when I think about the priorities we face in terms of public health, there are major public health challenges such as young people's mental health, adult mental health, cardiovascular disease, frailty. But there's also the challenges the local authority faces from people experiencing the most acute crises. And I think we need to engage with all of that. And all of those are the challenges that we've.
No, thank you for sharing. And like you say, it's such complex social issues that you're always battling. against. Is there a story or a project or program of work from your career, whether Newham or previously, where these underlying factors led to a breakthrough in community health outcomes?
I think these things are never simple and linear. And particularly in a place like Newham, our population changes all of the time. So, easily being able to track, we did this, and the result was, X percentage of people are Y healthier than they were before, is always an incredibly difficult thing. We're not operating in a controlled environment. We're operating in the absolute opposite. But I'll talk about a couple of things which I think are nice examples. When I started in Newham, we had a huge challenge around street homelessness. In one part of the borough, there was a shopping centre which had was open, not the shops, but had a route through it that was open through the night. And that shopping centre had essentially become an incredibly dangerous informal homelessness shelter. And beyond that, tents started emerging all around there. And it was an enormous challenge. And we found out, for example, in some parts of the world, there would be flyers circulated saying that this shopping centre was a good place to start life when you came to London. And what we knew, we had to do something completely different. And there had not been a strong history of supporting people experiencing homelessness in a very holistic way locally. But we changed it. And we said, actually, we're going to bring people together. We're going to bring services together like health services, the voluntary and community sector. We're going to take a much more responsive approach to people's needs, responding in a much more holistic way. And initially, that work started, and then COVID hit, and we were supported by the policy of everyone in, the really strong support to get everyone off the streets. But actually, what has endured over that period is that although Newham remains a place that attracts a lot of people to rough sleeping for all kinds of reasons, although we've closed that shopping centre through the night, the nature of our services and our pathway that responds to people's needs, recognising the complexity, supports people in a very holistic way, thinking about their mental health needs, substance misuse, their legal needs, a whole range of factors. We've supported over 1,000 people off our streets and onto a pathway towards independence. And I think it's for people with a really acute set of needs. We've shown how profoundly you can help people if you work in the right way. And to take a different example, coming out of COVID, one of the challenges, some of our community said to us, one of the challenges we've been experiencing is our older people have been stuck inside for 2 years. And we know that people from Black and minority ethnic communities are much more likely to experience vitamin D deficiency. And that would have been compounded by being stuck inside for a couple of years through the pandemic. NICE recommends that people have vitamin D supplementation, but nowhere does that. Can we do something on that? So we went away and looked at it, and absolutely the evidence suggested it was the right thing to do for our older population. And actually, vitamins are incredibly cheap. But what's not cheap is getting them out to people if we were to kind of develop a vitamin D service. So we went back to community organisations and said, I'll tell you what, this is the right thing to do. We will buy the vitamins if you will deliver them. We're not going to commission you. We're not going to pay you. But this is going to be a partnership of common purpose, where us as the local authority and you as community organisations, we're trying to achieve the same thing. And guess what happened? Well, over 40 organisations put their hand up and said, you know what, we want to be part of that. We will be your delivery agents. You give us the vitamins, you give us some training and some support, and we will get the vitamins out to people. And we've reached tens of thousands of older people in the borough through our vitamin D campaign. And what it speaks to is the way we try and work in Newham, which is partnerships of common purpose. That we work together as a place, looking beyond the boundaries of what kind of organisation we say. Different organisations can bring different things to the table, but if we're working to the same goals, to the same purpose, we can achieve so much more than if we work independently. And I I think that vitamin D example is one of many fantastic examples of that.
Yeah, thank you for those two examples. They were great examples. Not heard anything like that before. So no, I appreciate it. Um, let's talk current day. So I want to congratulate you on your new role, leading public health for the Health Foundation. What attracted you to the role and what will you be doing there?
So it goes back to where I started my career, really engaging with policy, and I deeply believe in what we do locally matters, but I also believe that the policy environment shapes the art of the possible. And as you know, if we can make a difference at policy level, we can have a huge impact on people's health and well-being and on inequalities. And I felt ready after spending the last 15 years or so working at a local level to really go back into that policy environment to try and make a difference. You know, we've got a Secretary of State who's of health, who says that prevention is absolutely one of his priorities. So I want to go back to the Health Foundation and really use that as a lever to drive change. Help national government, local places really to be able to do what we say a lot, but we struggle always to deliver on, which is we're strong on the rhetoric on prevention, but I think we can go so much further in the reality of it. And so that's going to be my role at the Health Foundation, working with a fantastic organization to really put that prevention rhetoric into practice.
Excited. Good luck. Not like you need it, but no, very much looking forward to what you achieve there. No worries. But obviously still current DPH at the moment. I think, look, personally to you, what are the most rewarding aspects of being a director in public health?
I think one is building a team and supporting and watching people grow. I make a really big point of distinguishing between leadership and management. And management is a function of someone's position, but leadership is a function of your behavior and your approach. And I have got the most amazing public health leaders in some of our most junior entry-level positions. And watching a young graduate early on in their public health career, but empowered by their sense of passion and vigor and what they know, going out there and doing amazing work, that's incredibly invigorating. So seeing new public health leaders emerge, and that's one for sure. And as a leader, you walk on the shoulders of your amazing team, and you get to all of the kind of reflected glory of the brilliant work that they do. And so it's seeing that amazing team flourish is absolutely one of them. And the other one is the partnerships, and I've spoken about it a lot, but seeing these amazing partnerships blossom and grow across everything that we do. We counted some months ago, just amongst the public health team alone, the number of meaningful relationships that people said they had with community organizations. And the number got to over 500. So that's not just people that they know, but people that they actively work with across our community. And that's how you achieve meaningful change, not, like I say, by doing things alone in isolation, but building partnerships of purpose on every single public health issue that we prioritize.
Two great points. Thank you. And just taking it back, last question, but bringing it back to your first point, which was sort of for aspiring public health professionals, what's the most important lesson that you've learned around building a meaningful career? And what advice would you give someone starting out today?
I would say, think of yourself as a public health leader. That public health at its core as a discipline, it's different to other things a council does, which can be just about managing a service. Public health is about achieving change. It's about achieving a different state of the world from the one that we're currently in. And that's a leadership function. That's a leadership challenge. And have confidence and see yourself as a leader, whatever level you're at, whether you're a DPH or an assistant public health officer, whatever level you're at, see yourself as someone who's bringing a vision of leadership, a vision of a different world to your work, and inspire people with your values, with your openness, with your capabilities, and your confidence to get out there and make stuff happen.
I think that couldn't be a more inspirational end to the podcast. Thank you so much, Jason. It's been a brilliant episode today. Thank you for sharing so much. It's been really in-depth, detailed. Obviously, we can all see the passion and experience that you have. So, no, thank you so much for today. And yeah, good luck in your new role.
Thanks, and thanks for having me.
Thank you, everyone, for tuning into the Public Health Spotlight podcast, partnered with ADPH. Speak to you next time.